Similar to questions about euthanasia, to answer a question about abortion in the interview, you need to be familiar with what the law is and to have points on both sides of the argument. So the UK law states that an abortion can happen up to 24 weeks voluntarily, and beyond that an abortion can happen if it's going to pose a challenge to the mother's health or if the child will be born with any birth defects such as Down syndrome. The arguments in favour of abortion, so pro-choice, would state firstly autonomy, so patients have the right to choose what they do with their own bodies. It is ultimately the mother that carries the baby, and ultimately they have the choice to determine what happens to their own bodies. Additionally, if abortions were made illegal, then they could potentially continue to happen and happen in unregulated ways that are outside of the medical field, and that could pose a risk to the health of the women that have to go ahead and do it. So there are a couple of arguments on the flip side, on the pro-life side of the argument against abortion. Primarily, these centre around the philosophical argument of at what point does a fertilised sperm and egg, forming an embryo, then growing into a fetus, at what point does that become a person and does it get legal rights? So in UK law, that point happens at birth. But around the world and in different countries, there are different opinions on that. In the interview, you need to show an appreciation that some people have a differing opinion on at what point a fetus or an embryo starts to get rights. Some people draw that line a lot earlier in the pregnancy, and some people draw it a lot later. The important aspect of this for the interview is that you show an appreciation for both sides of the argument and present both sides if asked what your opinions about the topic are.